I fractured my shoulders, separated it, motocross racing, and went to Dr. Pollack. And I think the first thing you notice about Dr. Pollack is he listens to you. You know, he's not thinking 5 minutes in the past. He's not thinking 5 minutes ahead. He's focused on you, which is comforting. And when you leave, you don't have any questions. I mean, that's what I like in a doctor. You feel very comfortable with Dr. Pollack. And he did some surgery on my shoulder, and I'm heavy into sports, you know, and motorcycle racing and activities. And I was leery about going back to him due to the injury, and he gave me full confidence I would be. And of course, I doubted, you know, as we all do. But no, he was right on target. You know, 6, 7 months after surgery, I healed up, got my strength back, went back to my sports. Very happy with the outcome. The biggest fear was to go home and tell my wife what I did, because that was going to be difficult when my clavicle's sticking up through my shirt and I'm driving home from Maryland and say, yeah. But all the way up from Maryland driving with a fractured shoulder, I'm thinking I get Dr. Pollack to look at this, because it's the first person that came to my mind. And I could pick half a dozen doctors that I could have gone to, but I picked Dr. Pollack. You wait through the x-rays. Typical patient would be seen. They would get the x-rays done, and you're still sitting there worrying. And then you go back to the doctor's office, and you wait for that doorknob to open, and he comes in, and you know, what's he going to say? And he goes, walks to the x-ray screen, and the doom and gloom comes. But Dr. Pollack's demeanor was wonderful, and he calms you down. He tells you exactly what the deal is, and you could do this, you could do that. He gives you several options. Not necessarily surgery right away, which I liked as well, and that was one of the options, but I actually opted for the surgery, and we went through a scenario of good and bad you know, results from each, because I wanted to go back to, you know, racing and performing. And then during surgery, it's the same demeanor comes to you at the bedside. You know, you're calm, you relax, he tells you what he's going to do, any questions. You want to back out, he has a great, you know, sense of humor as well. And he was dead on when he said, you know, 3 to 6 months afterwards, you can get back on a bike, have some fun. And I'm like, okay. And he was right. You know, 3 to 6 months after, I was back riding. The pain level was what he told me it would be as I progressed and healed. Therapy was an option. I took care of myself on that. But and the outcome was superb.